not taking people. So it was one of the matron that came in and said, I looked at her and said, Dawn. Immediately she called her nurses, because in a hospital like this, most of us, when we go to hospitals, we're not meticulous. Yes, that is one thing. We're not meticulous. We're not always very, very grounded with things that are happening. In fact, we don't even know the hospital we are attending sometimes. We don't even liaise, or we don't even have good rapport with the nurses. We just feel like because we come to the hospital, we should have our needs. There's certain things. Yes, immediately. We don't rapport with them. We don't even want to sit down, talk to them. We just come in, do whatever we want to do, and we leave. So when they brought me in,
go ahead.
So when they brought me in, immediately they now had to tell the doctor that somebody was there. Before the doctor came in, these nurses were struggling to find my vein, and I was still throwing up there. Immediately the doctor came in, he just inserted. And I said, what are people wasting time? This lady came in since, and you've not inserted, Now, that timely intervention is not just important, it is very, very paramount.
Very, very.
Because at that point in time, if maybe they don't even know you, they've already sent me out already now. Before you even go to the next hospital, something would happen to that, patient. So we employ nurses and doctors, in as much as we say we don't want violence. Please, we want you to hold on to that profession and make sure that you give your best. We're not saying you give your life, but you give your best to ensure that people that are coming into will also appreciate your work.
Yeah, well said. And this is where professional ethics actually comes to play, right? You're there for a reason. You swore to an oath to protect, to save lives. Irrespective of the situation. Okay, so we're going to try to balance this as much as we can, because first of all, before someone will attack a healthcare provider, right, something must have caused it. There must have been something that must have triggered that person to act. So it's this issue of timely intervention. So I was trying to make a point, right, before you came in, and then I was overwhelmed when I got to the accident and emergency ward. Done. When I mean I was overwhelmed, now it had nothing to do with timely intervention, because the number of healthcare workers I could see, in fact, all of them were busy. They were all busy at the same time. And then you had some people they were still rushing in people.
But human beings will not understand.
That's my point. Understand where I'm coming from. So with that scenario now, where you have, for instance, only 6 nurses on duty, right?
Yeah.
And maybe 2 doctors.
Okay.
Because the doctors are not many.
Yeah, they're not.
You have only 2 doctors. And then at that particular time, you see them attending to some people that have just been rushed in.
Yeah.
And then more people are coming in. What do you expect? They'll have to wait, right?
Yeah.
But sometimes, due to the nature of that accident, if nothing is done early enough, the person dies.
Yeah.
And then you start to blame the doctor, right? Meanwhile, he was trying to save another person
that came in before.
And then most times, that is why some hospitals, when you go there, they will redirect you and tell you, oh, please, our ward is full.
Yes, go.
Please take this person somewhere else. And then you say they rejected you. The issues are plenty, actually.
Is it that we should,
before
they tell them to go, we should actually beg them? Should the workers beg them that please
at that point, now my point is, nothing justifies the act of beating up anybody.
Yeah.
That's the angle I'm coming from.
Yes, nothing.
Yeah,
nothing. In all honesty. Yeah.
Even if they don't beg you to go, right? Because them too, they're under pressure. Do you know how overwhelming it can be? Sorry, the party A has come in with blood on his legs, on his head.
But there's something called courtesy.
The second person has come in, the head is open, and they need to really do something urgently. The next person has come in, the arm is broken. If you go to accident and emergency ward, done, you understand what I'm saying, right? So yes, courtesy. You wanted to talk about courtesy?
Yes, courtesy.
Talk now. Are they here?
It's bad though. I've seen a lot of things. But I just feel like, this profession is a very good one. It's a sweet one. This health worker. Immediately, Mary told me this was going to be discussing. I'd already started giving her. See, it's a very sweet profession, but at the same time, we want to see the sweetness in this nurse because it's a life. I'm not lying to you. When somebody's already bleeding from the house and you're coming to the hospital and they're telling you, will you get back? No. Please. It's just like in a teaching field. This health worker thing is also in a teaching field or in the teaching field. I was a teacher too. You see a parent coming in without, morals. They'll just want to slap a teacher.
Let's not even go there.
You understand? So is it in every occupation? But we're saying that anything that has to do with the hospital or has to do with a life, please, you should hold it dear to you. You know, when you watch Americans, the way they treat people, we watch it in movies and we think maybe they are over exaggerating, but it's real. They take care of lives like as if it's their own life. So we here, we don't do it.
Hey.
But it doesn't justify that somebody should beat up a doctor.
You just reminded me of something, right?
Yeah.
Yesterday, we were in a meeting and I heard something and I'm like, wait, so what am I doing in this country? I got the information that in Australia, people who are living with mental health issues are well taken care of.
Yes.
That they even pay them. And then someone made a comment and said, me, I'm not okay. I need to go. Oh my goodness. You know, things work perfectly in other climes because things are well organized. For instance, what we are trying to say is, yes, let's not mix up things, right? We're trying to speak against the constant victimization, constant assault on resident not just doctors, healthcare workers, right?
Yeah.
In as much as we're trying to talk about that, we are also frowning at the system.
Yeah.
We feel that things are not properly organized. Because if things are properly organized, for instance, you have the accident and emergency ward. I actually might not know how these things are actually set up, but correct me if I'm wrong. I feel there should be a first person to meet or the contact section.
Yeah.
Where those people are first of all rushed to. See this one, in don't break leg, where you see them along Oka Road, you take down the details, right? While you are waiting for the doctor to come. But this one, they just pack all of them straight up, and the doctors and nurses are overwhelmed. You know, you understand what I'm saying?
Yeah, dearie.
So I just feel that the whole system needs to be reset. You don't just bring people like that. And first of all, before you even bring those people, find out if the person you are now meeting will not be the one to go in. And find out if there's enough space to accommodate you. Right? But it doesn't work like that here. It doesn't. Where we go carry this person, go in, get accident. Accident, pyong! They carry the person straight into the ward or into the open space. I don't know what that place is called, right? And then you start to have issues like this. So, but in all, we are saying that
there are better ways.
There are better ways of expressing your grievance, whether as a visitor, whether as a patient, or whatever. Not just the accident and emergency ward, the pediatric ward as well, maternal and child care section, right? That's another place where, in fact, doctors, they beat them basbos, even nurses.
And we don't have doctors in that pediatrician
we have actually, right? But it's mostly the nurses who are always around, you know. My point in all of this is, most of the time, women are told constantly, go for antenatal. Go for antenatal so that they will check you and know if you've got any problem. Hey, Kwechiri, I don't born one, born two, born three. This one, now the fourth one, I don't need them.
No, you need it.
I don't need them. Oh, I am experienced.
No,
I'm telling you, it's reality,
it's
right?
true.
You are a mother, I'm a mother. These are things we see. And they tell you, I know, what do you want to teach me? I'll just go there and be dancing. Go and be clapping my hands.
In fact, go there and clap your hands.
Thank you. What do you want to teach me that I've not heard before? And then they go ahead to take care of themselves. Now, there might be complications you might not notice early enough. And then when you go into that room and something happens, you start to drag, not even you, because you might not even have the strength at that time. Your person who has come, who has accompanied you to the hospital, starts to drag the healthcare professional on his jacket. What is that thing called? Coat.
A lab coat.
Thank you. On the coat. Our jacket. It's terrible. See, we are laughing over these things, but it's not funny. You know, I wish some healthcare providers who are listening to me will call in to also share their experiences, because these things are happening. And it's not funny. So please let us stop. That's the message we are preaching.
Yes, please.
Whatever happens, let us stop. Now, I forgot to add that we'll be linking this issue of victimization of healthcare providers with the psychological impact it usually has on them.
Yeah.
For instance, let me give one example. As a medical doctor, let me say I'm a medical doctor, right? On Monday, I went to the hospital and a pregnant woman was rushed in. I'm just using that as an example. Or someone was rushed in, an accident victim. And I did my best. I tried everything. There was timely intervention, right? I did everything, but the person passed. They beat me on Monday. On Wednesday, I have to go to the hospital. If I'm on call, I have to go. And then on Wednesday, I go back to the hospital. And then it seems more like the person is about to die. Yeah. And then the incident that happened on Monday will now flash through my mind. Yeah. And I get scared immediately. And at that point, I'll even be more confused. I know what to do, but I'll be like, hey, if this person die now, they go beat me another second round. And it starts to impact them mentally. Yeah. So there are lots of psychological effects or impacts when you assault a medical or healthcare professional. We don't have them plenty. Yeah. We don't. And if all of them decide to go, go. Now, Eba. You will go to the bush in your house and go and start plucking leaves. We'll go back to the era of our great-grandparents and our ancestors. Eba people will make money that period. That one bottle that can cure 20 ailments. That's when you will see them in action, So, but this is what it is. Okay, so before we talk more about the psychological impact, I feel we should open up the phone lines for people who would want to, join the conversation this morning, share their experiences, and tell us what they think about the topic for today.
Okay, and the phone line to call is 0911 20022, 0707 454 1014.
Okay, alternatively, send us a WhatsApp message on 0707 491 3438, 0707 491 3438. And we are live on Facebook at Echo FM 100.7.
Hello.
Hello, Slim Diva.
Hello, good morning.
Good morning.
What's your name?
This is, thank God, this is Mr. Robert.
Mr. Robert.
Yes, calling from Old Road today.
Okay.
See, this issue you are discussing now is very, very crucial issue. And I will not advise for anybody to be doctor. But most of the times, my dear, someone that asks that might have something else. Unlike I said that talking to you now, I'm a victim of this type of thing. My wife is pregnant. I take I will not call the hospital, a very big hospital. And I take my husband to that big hospital on the basis that I will not like to have this type of issue. Now, the woman that is, the time to deliver. Now, they take to the hospital, they give her hot injection. Hot injection. They take the woman to the ward, keep her to bed. The water will hold the whole side to grow and waste out.
Are you there?
Yes, I called them. Come, they come. They took my wife inside the theater. Keep her to please. This woman was bleeding, They begging them, please come and attend to me. They did not do that. Until the child died inside the womb.
Oh.
When the child died inside the womb, my wife started crying, please come. They tell my wife, stop crying, stop talking, stop shouting. Because I was trying to push the baby out of, only herself. She said, don't you okay yourself, the baby have died.
Oh.
Who is that? Who is in that? Now, when I get, I just, if not the type of me, if I act, they will say that the man is mad, the man is this or that.
Yeah.
Sometimes when the person acts like this, maybe something wrong is somewhere else. So sometimes we look at, sometimes I'm beating the doctor better.
Oh.
So
Mr.
sorry.
Roberts, this is a pathetic story. I mean, very touching. And yes, you are human. If you had even given them a better bit, I won't blame him, right? From his own angle, we've not heard from the nurses what exactly transpired. But that is a terrible thing. And that brings me back to what I said. The system. Yeah. The system is flawed.
Very, very.
In other places, in foreign countries, that person will not go scot-free. You see those nurses, they will lose their license immediately. You dare not. But here, nobody cares. Oh, let's take more calls.
Hello.
Good morning, my beautiful lady.
Good
morning.
morning.
How are people doing?
Oh, fine.
We're very well.
What are we speaking
name
with?
is-
Okay.
My name is Santos. I'm calling from Iyagwa.
Okay. You're welcome.
Yes, I heard your program this morning.
Go ahead, please.
If somebody's wife is delivered the hospital and the baby dies, the person is not supposed to fight the doctor or the nurse. It's the will of God. I'll just ask them if my wife is alive and console her. That's all. No need of fighting, because it's not the will of the doctor or the nurses for the baby to die. That's my own contribution about that.
Okay, thank you very much. And he's simply saying that people should try as much as they can to control themselves, restrain themselves from taking some action that they will regret in the future. If you remember my opening statement, right?
Yeah.
I said the doctors save lives, but they are not God.
Yeah.
They can save lives, but they cannot keep a life.
Yeah.
They are two different things,
Yeah.
okay? All right.
Hello.
Yeah, good afternoon.
Hey, good morning.
Oh, morning. I don't follow say afternoon. Morning.
Good morning.
Yeah, all the same. We are in Nigeria. All the same. Though.
Yes, you're welcome.
Seriously, this topic is so sensitive. You understand?
Yeah.
You see, FMC, this FMC will receive. It's just a crazy.
Please, no, I will not allow you do that, okay? You can call me back, right? But if you'd have to make reference, do not mention the name of any hospital. That is one. Secondly, watch your words. Be civil with your words. You can't call a hospital crazy. No. Okay? In as much as we've got our flaws, but we're finding a solution, I will not allow you use this medium to insult anyone. Thank you very much. Hello?
Hello.
Good morning.
Good morning. Who are we speaking with this morning?
Yeah, my name is Ugochukwu.
Oh, Ugochukwu, you're welcome.
Yeah, I've been listening to your program.
Okay.
Yeah, my contribution is that, most of this thing we are discussing about,
Yeah.
they are caused by the doctors. I can tell you that if you calculate most of deaths we have in the hospital today, I can beat my chest and tell you that 80% of them is caused by the doctors, carelessness of the doctors. Let me use my wife as an example.
Okay.
My wife, when she was pregnant, do you know that the doctor she is seeing for antenatal, each time my wife calls him to ask him if he's in the hospital, he will ask my wife to come in the evening. This doctor works in 3 hospitals. One particular doctor is working in one hospital. How do you want this doctor to perfect very well in each of the hospitals he's working at?
Okay.
Okay, take for example, this woman, one of these popular women.
Chimamanda Ngozi Adichie.
Yes. When the son of the doctor died?
The son, twins, one of the twin sons.
It's because she's a popular person. That was why the investigation was carried on. And when they did the investigation, they found out that it was the carelessness of the doctor that caused the...
Not the doctor. Let's not mix up things. The anesthesia.
Anesthesia.
Bam. Oh, Lord. Go ahead.
But what am I trying to say?
Yeah.
70-80% of deaths we are having in the hospitals today is because of the carelessness and the negligence of our duties in the hospitals.
Okay.
So can you believe my wife is pregnant, and this time he calls the doctor will ask him to come in the evening.
Okay.
What assuming something is happening to her in that morning, maybe in the morning she's having one issue or the other. and she calls the doctor to ask him if he's in the hospital. The doctor will tell the child to come in the evening.
All right,
Maybe
thank you.
before that evening, maybe whatever might have happened would have happened.
Okay.
You know, so
Thank you.
Thank you.
Thank you.
Thank
All
you
right,
so
Ugochukwu,
much.
thank you.
Yeah.
So it's an anesthesiologist. It's a mouthful, so don't blame me, okay? That was the person who was fingered in the death of Chimamanda Adichie's twin son. I wanted to just, correct you a little bit so you don't make that mistake. So he made a point.
Yeah.
When a doctor works in more than 3 hospitals, it still takes us back to the system, which is flawed.
Yeah.
Remember, myself and Don, we have constantly talked about the pressure that these doctors are faced with. And then secondly, another advice to people who do not have children yet, but you are expecting. I always tell mothers or mothers-to-be, right? Register in at least 2 different hospitals. If you're pregnant, when you're pregnant, right? Don't just depend on one hospital. They usually recommend you register in a government hospital and a very good emphasis, very good private hospital. It's not some people now, if you go to Round Owerri, I was amazed the other day on one street, I saw more than four clinics.
Yeah.
Someone can just wake up one day and convert his flat to a clinic, and people will call it a hospital. It's not a hospital, Oga. You know? So when you have a specialist, because that's what they are called, a consultant, working in more than 3 hospitals, that's because the ratio of doctors to patients is something we cannot even imagine right now. All of them are leaving the country. So in that context, I will not even blame the doctor, because while your wife was calling him, it's also possible he was attending to other people. He had an emergency. And then if you had registered somewhere else,
you wouldn't have to.
You won't have to depend on him. You just quickly take her to the other place. So, but I'm so sorry you had to go through all of that, okay? And that's what we are trying to talk about this morning. The system needs to change. Thank you.
Okay, hello?
Hello,
Yeah.
Mary.
Yes,
morning.
please. Good morning.
Good morning. How is it?
We're doing great. What's your name?
Okay, this is Mr. Chubike.
From
Okay,
where?
You're welcome.
I'm calling from Modu.
Okay.
All right. Your discussion is quite interesting.
Thank you.
I've really enjoyed it. More especially from Ms. Dawn Ekom. I really like the way you people organize each and every topic that you want to discuss.
Yeah.
Thank you.
Thank you very much.
And this one is kind of touching. Look at, there's something I want to add on this.
Okay.
Just like the way you are in the studio now. People are listening to you and they enjoy your program. Because I would say that you are in the area of your own calling and you handle it perfectly. Now, most of the issues that we are having in this health sectors are because most of them are not there because they have passion for it. Most of them are being pushed maybe to go and read whatever. Because whenever somebody is doing what you know that this is your area of calling, that person will always give 100% of his time or her time to that work. My wife today did that through tears. You say I should not. You say we should not mention any.
Please don't.
hospital.
Yes, please.
Now, when my wife wants to have her first baby, it's just a little mistake from the nurses there. And now we have gone 4 rounds all through CS.
Yeah.
But what that could have controlled from day one, because of those doctors there, they were so careless about it. You can imagine when a doctor are telling pregnant women that are struggling for them for their life that they should stop making noise, that they are disturbing them.
Okay.
And this person that is saying that your patient is disturbing you, he's not even doing anything. He's just looking at her finger. This somebody that call herself a nurse wearing a very long nails. Now coming to attend to my wife, you now say that I'm not seeing your vein. How can you see vein with all those long nails?
It's not funny. Oh God.
So that I'll be the one to tell this is where the vein is. My wife keeps shouting.
Okay.
She will come and one finger, three, this daughter. Whereby this thing that is overdone.
Oh.
I don't know how to
try to summarize. We understand you.
So this is just the issue. They are there maybe because their parents or whosoever is pushing them to go over that career.
Thank you.
If you know that this is what you want to do, that person will do it with every satisfaction. And you will not see pain on that person.
All right.
So that's my own contribution.
Thank you, Mr.
Thank you very much.
Chibuike. I talked about the ethics of the profession, right?
Yeah.
Growing up, yes, I grew up in a family, that is health inclined, okay? My mom, for one day, you never see nails. I know it's part of their ethics.
Yeah.
Even their hair, then, I don't know of now.
Yes.
Yes. Neatly packed. They used to have a white something they even used to hold the hair so that it doesn't disturb the job. And then your uniform too will be a little bit decent, right?
Yeah, it's very, very decent.
Very decent.
It mustn't go above the knee.
But what we see these days, I concur with Mr. Chibuike. You see nurses fixing nails, even eyelashes. How will you see vein with that eyelash? The one that looks like fan. How will they see the vein? A lot of issues to talk about, but let's not digress, okay? Yeah. Mr. Chibuike, thank you for bringing up these concerns. And trust me, when I tell you that people are listening,
yeah, they are.
They will take these things. They always copy, copy and paste. All these things we say every day, they go and copy it, Those in the House of Assembly, the Ministry of Health, Ministry of Environment, they take some of these things and make up their points. That's what they used to work. So trust me when I say that a time will come, we'll stop to see all of these things, okay? Yeah. And we are doing our part. Thank you for also contributing. Okay, psychological impact, before we run away from the studio this morning, psychological impact of, attacks on healthcare workers, because it's part of the topic for today.
Okay, attacks on healthcare workers, whether physical assault, verbal abuse, threats, or harassment, cause deep harm that goes beyond physical injury. Here is how it affects them, their work, and the health system. 1. Trauma and fear. Many develop acute stress, panic attacks, or PTSD symptoms. They feel unsafe at work, flinch at loud noises or voices, and dread their next shift. Anger and betrayal. I came to save lives, while attack me. This creates bitterness toward patients, relatives, and sometimes the profession itself. Shame and humiliation, especially if attacked publicly in the world. Male and female health workers report feeling degraded and powerless.
Yeah. Okay, so the tongue twisters happening not just to me now, to Don as well. And that's one thing the microphone does. It will catch all the errors. Okay.
Everything.
Yeah, everything. So the psychological impact, she has said it all, right? I will add, there's also long-term medical health consequences. You have burnout on the part of these healthcare workers, emotional exhaustion, constant fear. Why is it that anytime I'm on duty, something bad must happen? In fact, I don't want to go to that work today, but we depend on you. So please, you have to continue. Depression, substance misuse, and then some indirectly, secretly, will start to abuse substances to give them that morale to go and face whatever it is they want to face. I'm working in an accident and emergency ward. They might bring somebody that the intestine is bulging out. How do I face that patient? And they start to take some substances to help them cope. Do you think it's only normal, ordinary individuals that abuse substances? Some healthcare workers do, because of the pressure that they are faced with. If it goes beyond, overboard, depression, PTSD, and then it leads to suicidal thoughts. Yeah. I remember sometime 2 years ago or so, more than once, it's not twice, we heard stories of doctors who jumped into the lagoon. They were not alive, or they are not still alive to tell us why they did that. It might be as a result of pressure. Nobody knows. And then it starts to impact on their job performance. And that's why most of the time, yes, I know that, like I said, we have the bad ones. In every profession, there are bad eggs.
Yeah.
Every sector. Be it in broadcasting, in health, in the police, security, in the school, there are bad eggs. But unfortunately, you know what gets me angry? It's the good ones that suffer from these assaults.
Yeah.
The good ones that have brought out their minds to work, they are usually victimized against. And that's why they now change.
Yeah.
And they say, after all, somebody beat me the last time. I will not tolerate it again.
It's the truth.
Do you understand?
Yeah.
And then they change their attitude towards everybody. But we are not in support of that, too.
Yeah, we're not.
We are not in support, right? Like I said, this conversation has a balance.
Yeah.
We'll hit them on the head,
Those
and we
ones that
also
are wrong
pet
and
them
those
on the
ones that are
back.
right. Yeah.
Because we know that there are some people who work hard to
Yes.
save lives. I told you of one doctor I know. The other time he felt terribly ill. Why? 3 days at a stretch, saving lives. And nobody goes to pet them. Let us at least for once talk about the good things that they do.
Yeah.
You see the nurses, let's leave their talk. Some of the nurses, not all. Some.
Yeah,
Some that don't know about the ethics. They don't even know why they are there. They are just there because, some
want
of,
to wear white.
you know, I asked a lady the other day, you're studying nursing, right? And she said, yes, so, I'm almost rounding off. Thank God I even chose this profession. And I asked her, really? So why did you decide to study nursing? I want to jackpot. The moment I'm done, I heard that they pay them very well. They pay them very well in other countries. The moment I'm done with this, my course, I don't come up for this country. I'm like, whoa, that's just why. You did not even tell me the very first thing I was willing to hear.
Yeah.
I'm studying nursing because I want to save lives. I want to be, part of the team that will be saving lives every day. No. It's no longer in their agenda.
It's true.
Parents send their daughters to study nursing because they want to send them abroad. So they will be sending dollars and pounds for them. And that's it. And then you hear some men, Owuru nurse. How do they say it in Igbo?
Owuru nurse.
Owuru nurse. Mama, I know ya. Did I get it?
Agama Noya.
Hey,
2-0.
J-boy, help me. You are laughing. How do they say it in Igbo? Owuru na wu nursing, right?
Ya wu nursing aga.
Iga. Mama, I know ya. Are you actually speaking the right thing? I don't even know who it was. You are misleading me. Don is misleading me in this Igbo language. Oh God, I wish Clara was here. So no, we are laughing, but we really have a long way to go.
A long way.
Yes, so don't forget what triggered this topic in the first place.
Yeah.
Just yesterday, the Nigerian Resident Doctors Association of Resident Doctors Delta State chapter released a statement, and they said they have embarked on 48 hours strike. And they gave an ultimatum, 48 hours to the government, and they said if nothing is done about their staff or their colleague that was assaulted, they would go on indefinite strike. And it's an association. Yeah. So they might decide to reach out to other doctors in other places, and then we start to have issues again. Yeah. So that's why we are using this opportunity to call on everyone. If you did not take anything home, take this one home. Yeah. No matter what happens when you get to the hospital, please restrain yourself. Yeah. I beg you. So you don't take laws into your hands. I know that it can be annoying most times. I know that most of the bad eggs we have in the healthcare sector are not even helping us at all. But please do not go all out to attack them. Yeah. Okay? You can decide to report to the police or just look for. We have social media now. Very dark man, what do they call the advocates everywhere? Yeah. You can easily reach them and they will help you. Rather than going physical, because if you go physical and that person dies,
you still go in for it.
That's murder case. So let's go. Parting words.
What I want to just say is both patients and the healthcare workers. For the healthcare workers, it's a profession that you have decided, you choose it, that you want to save life. Please bring out your best in order to ensure that you save life. And for us who actually visit the hospital, I want to implore you to restrain and discipline yourself. I know that Mary has said things happen. Yes, things happen, but please restrain yourself from doing anything harmful and take the legal route in order to ensure that that particular thing is solved and solved in an an awesome way. Thank you.
Okay, we have said it all this morning. A word is enough for the wise.
Yeah.
Okay, we'll keep preaching, we'll keep shouting until change comes and until the right things are done. Thank you very much for listening. Thank you for your contributions. To those that called, we appreciate you. My name is Mary Omeniwo. They call me the Slim Diva. You're most adorable.
And I am Judge Don Ikoma.
Thank you, DJ J Boy. Up next is the news.
Echo FM. It's the sound of the city. Echo 100.7.
Echo FM 100.7, the fresh news people.
This week to help those in need.
If you know that it's God Almighty that created you and created we Nigerians like you need to do good things for us because the masses are suffering. How you can suspend me here? Are we your slaves?
And I'm going to win this election.
That is the truth.
Stay informed with Echo FM 100.7. Join us for exclusive interviews with experts, breaking updates on local and global events, and in-depth coverage of issues impacting our community. Tune in every weekday at 6:30 a.m., 12 noon, 2 p.m., and 6 p.m. for our major news bulletin in English, Igbo, and Pidgin language. For more inquiries, you can reach us through our email, echofm@thekingmail.com. You can follow us on our social media handles at Echo FM. Echo FM 100.7 Owerri. We are the Fresh News People. It's the news at noon on Echo FM 100.7.
Good afternoon to you. This is the Global News at Noon right here on Echo FM 100.7 Owerri, the station with fair and balanced reporting. My name is Mary Omeniwo, bringing you the latest news and breaking stories around the world. Here are the headlines. NAD confirms commencement of CONMES arrears payment for resident doctors. PENCON warns public against rising job recruitment scams. Petrol marketers reject World Bank's fuel import proposal for Nigeria. And the UN reaffirms support for Nigerian-led solutions. At least 11 killed in fresh Israeli airstrikes across southern Lebanon. And on sports news, Besiktas keen on Ndidi's swap deal with United. Details after this break. Stay tuned. The Nigerian Association of Resident Doctors, NAD, has announced the commencement of payment of the long-awaited arrears arising from the review of the Consolidated Medical Salary Structure known as CONMES for its members. This was disclosed in a communication to members by the association's Publicity and Social Secretary, Abdulmajid Ibrahim, who confirmed that the disbursement process is already underway. According to the statement, the payments covers outstanding arrears ranging from 1 to 6 months for affected doctors, with several members reportedly acknowledging receipts. Ibrahim assured members who are yet to receive their payments that the process is ongoing and will be concluded in due course, urging patience as disbursements continue. He, however, noted that the August component of the arrears is currently experiencing minor administrative delays, which may extend payment timelines by about 1 to 2 weeks. The ongoing payment of arrears is seen as a positive step by authorities to address long-standing welfare concerns and reduce the risk of potential labor disputes in the health sector. In another development, the National Pension Commission, PENCOM, has issued a strong warning to Nigerians over a rising wave of recruitment scams, urging the public to remain vigilant and avoid falling victim to fraudsters. The Commission, in a statement shared on its official handle, revealed that scammers are increasingly impersonating its officials to deceive unsuspecting job seekers. According to PENCOM, the fraudsters are reaching out through various channels, including WhatsApp messages, emails, and direct phone calls, falsely claiming to offer employment opportunities within the Commission. PENCOM disclosed that victims are typically asked to submit confidential documents via WhatsApp, a tactic it described as a clear red flag. The Commission therefore reiterated its commitment to safeguarding pension assets while urging Nigerians to remain cautious and verify any job-related communication through official channels. And over to Ondo State, where the police command has arrested a suspected kidnapper and rescued its victim in Isua Akoko, the headquarters of Akoko Southeast local government area of the state. It was gathered that the victim was abducted by 3 men on a farm, but escaped after fighting and inflicting injury on one of them. In a statement issued by the State Police Public Relations Officer DSP Abayomi Jimo, the matter is being handled by the anti-kidnapping unit of the command for further investigation. The police spokesman further stated that the suspect had confessed to being part of the kidnapping gang, while the victim had identified the suspect, particularly noting the injury inflicted on him. The national coordinator of the Movement for the Advancement of Akoko Edo People, Bode Ekudayo, has confirmed that the suspect was arrested and one other person has also been arrested after making a confessional statement. Parents of the yet-to-be-rescued Chibok girls have called on the federal government, Borno State government, and also the United Nations and the international community to renew efforts to secure the release of those still missing. Also, a leading campaign organization for the rescue of the girls raised concerns over what it described as waning accountability and global attention 12 years after the abduction of 276 schoolgirls from Government Girls Secondary School Chibok, Borno State. They stressed that the passage of time had not reduced the pain or certainty surrounding the fate of the missing girls. They therefore urge authorities to intensify efforts to locate the remaining girls and ensure accountability in the handling of the case. Gunmen on April 14, 2014, invaded Government Secondary School, Chibok, and abducted 276 schoolgirls. It's exactly 8 minutes past noon. If you just joined us, you're listening to the global news at noon right here on Echo FM 100.7 Owerri. Here's a recap of the headlines. NAD confirms commencement of Conmen's arrears payment for resident doctors. PENCOM warns public against the rising job recruitment scams. Petrol marketers reject World Bank's fuel import proposal for Nigeria. And on the foreign scene, UN reaffirms its support for Nigerian-led solutions. At least 11 killed in fresh Israeli airstrikes across southern Lebanon. And on sports news, Besiktas keen on Ndidi swap. Details after this break. Stay tuned.
Did you know that certain harmful practices can negatively impact your health and well-being? If you wish to live a healthy lifestyle, avoid excessive alcohol consumption, engage in regular exercise and physical activity to boost energy levels, prevent chronic diseases, and keep you fit. Quit smoking and vaping to prevent lung cancer and respiratory problems. Limit your intake of highly processed foods and eat more of fruits and vegetables. Do not drink and drive. Do not use gadgets such as phones and tablets while driving. Do not forget to strap your seatbelt or wear helmets while operating automobiles. Do not engage in poor hygiene and sanitation practices. Above all, do not neglect your mental health. Stress, anxiety, and depression can worsen symptoms and impact daily life. Remember, small changes today can lead to a healthier tomorrow. This message is brought to you by
Echo 100.7.
Welcome back. It's good to know you're still there. This is the Global News at Noon right here on Echo FM 100.7 Owerri. We'll move over to business news, foreign and sports news. And in business news, petroleum marketers and experts have rejected the Washington-based World Bank's recommendations to Nigeria to open the country's borders for premium motor spirit imports to urge Dangote refinery. Recall that the World Bank recommended that Africa's most popular country should prioritize imports. Days later, the World Bank had deleted from its website the NDU report and clarified that its recommendation is not a blanket stamp on fuel importation, but a broader strategy linked to reforms and consumer protection in Nigeria. Energy experts have faulted the World Bank's stance, especially with the current global supply shock as a result of the Iran-United States-Israel war, which entered its 7th week today. Over now to the foreign scene, where the UN Deputy Secretary General, Ms. Amina Mohammed, has reaffirmed the organization's commitment to supporting Nigerian-led solutions to development and humanitarian challenges. UN spokesperson Stephanie stated that Mohammed had returned from Nigeria, where she visited Zamfara and Benue states and met communities affected by insecurity and displacement. He noted that she witnessed firsthand the scale of humanitarian needs as well as ongoing response efforts by authorities and partners. Meanwhile, the UN says digital tools are transforming Nigeria's response to humanitarian challenges, including tracking internally displaced persons, despite funding constraints and technology gaps. Nigeria, which has about 2 million displaced persons due to prolonged insurgency in the northeast, has adopted the displacement tracking matrix developed by the International Organization for Migration, IOM, to improve data and response efforts. UN Secretary General Antonio Guterres has called for stronger and more predictable financing, especially for vulnerable countries. Still on the foreign scene, at least 11 people were killed and others wounded by Israeli fire in southern Lebanon as Israel continued to escalate its attack across the Arab country. Lebanese media have reported 2 people were killed and a woman was injured in a strike on a home in the town of Arab Salim. A separate strike targeted the coastal town of Adlon, leaving 3 people dead. In the Tyre district, Israeli strikes hit the area between the towns of Ain Bao and Aitit, accompanied by the firing of illumination flares over the city and the sea. The Israeli army has expanded its air and ground offensive across Lebanon since a cross-border attack by Hezbollah on March 2, despite a ceasefire deal that took effect in November 2024. According to Lebanese health authorities, at least 2,089 people have since been killed and 6,762 others injured in the Israeli assault. And lastly, in the world of sports this afternoon, Besiktas are exploring a high-profile swap deal involving Wilfred Ndidi as they pursue Altay Bayindir from Manchester United ahead of the 2026 to 2027 season. According to reports, the Istanbul-based club have identified Bayindir as their top transfer priority as part of plans to overhaul their goalkeeping department with a focus on domestic talent. The 28-year-old Turkey international is reportedly seen as a key figure capable of bringing stability to a defense that has struggled for consistency this season. In a significant development, Besiktas has said to be willing to include Ndidi in a part exchange deal to facilitate the goalkeeper's return to Turkey. The Nigerian midfielder who joined the club from Leicester City has become a central figure and currently serves as vice-captain. Manchester United are understood to hold a long-standing interest in Ndidi, particularly as they prepare for the departure of Casemiro and seek to strengthen their midfield options. And that's all for the global news at noon this afternoon, edited by Benjamin Joseph. For more information and inquiries, visit our social media platforms on Facebook at Echo FM, X at Echo FM_Owerri, Instagram at Echo FM 100.7, and YouTube at Echo FM 100.7. You can listen to us anywhere in the world by visiting www.echofm.net. My name is Mary Omeniwode. Thank you for listening. Good afternoon to you.
It's the sound of the city. Echo 100.7.
Echo FM.
Echo FM 100.7, the fresh news people.
Right.